If we talk about the coronary circulation, what we can visualize is that the coronary arteries of the right and the left side, they get their origin from the aortic sinuses of the same name. They are filled with blood during the ventricular diastole. The right coronary artery, as it originates from the right coronary sinus of the aorta, ascending aorta, it moves to the right side of the pulmonary trunk. It then moves between the right auricle and the pulmonary trunk and enters the coronary sulcus. As it enters the coronary sulcus near its origin, it gives two branches, which are not visible here. One to the infundibulum of the pulmonary trunk and one to the SA node. Then it moves in the coronary sulcus and it gives off atrial and ventricular branches. As it reaches the inferior border, it gives off the right marginal branch. This is the main branch which supplies the inferior border of the right ventricle, and it goes towards the apex of the heart but doesn't reach it. It moves downwards and posteriorly following the coronary sulcus. At the posterior interventricular septum, it gives off the main branch, which is the posterior interventricular branch. This posterior interventricular branch determines the dominance of the coronary arterial system. The artery which gives rise to the posterior interventricular branch is the dominant artery. So, if it is getting origin from the right coronary artery, we will say that the heart is right dominant. This artery then moves in the coronary sulcus, and at the area where the interatrial and the interventricular septa meet, it gives off the atrioventricular branch for the AV node. In the coronary sulcus on the posterior side, it forms a small anastomosis with the left coronary artery. So, the right coronary artery gives blood supply to right atrium, most of the right ventricle, its anterosuperior as well as the diaphragmatic surface, part of the left ventricle here, the diaphragmatic surface of the left ventricle, the posterior 1/3 of the interventricular septum, the SA node here, the first branch, SA node for 60% of the people, and the AV node in 80% of the people. Talk about the left coronary artery. We say that the left coronary artery originates from the left aortic sinus of the ascending aorta. It moves between the left side of the pulmonary trunk and the left auricle, and it reaches the coronary sulcus. As it reaches the coronary sulcus, the artery, which here it is shown in its divided form, is divided into a left interior interventricular branch and a circumflex branch. The interior interventricular branch descends onto the anterior interventricular septum. This branch is also called left anterior descending artery by the clinicians. As it moves in the anterior interventricular groove, it provides branches to the right and the left ventricle. It goes towards the apex of the heart, supplying the apex of the heart, and can move towards the inferior and can anastomose with the posterior interventricular branch of the right coronary artery. The left coronary artery, the anterior interventricular branch, can also supply the SA node in 40% of the people by an SA nodal branch. The second branch is the circumflex branch of the left coronary artery. It moves around the coronary sulcus, around the left border of the heart, and enters the posterior part of the coronary sulcus. At the left border of the heart, it provides a left marginal branch. As it moves to the posterior part of the coronary sulcus, it can anastomose in a little amount of people with the right coronary artery in the coronary sulcus. So, it terminates in the coronary sulcus before reaching the crux of the heart. So the supply of the left ventricle is to the left atrium, most of the left ventricle, its interior and the left sides, some of the right atrium, its anterior part, anterior 2/3 of the interventricular septum, and to the AV bundle of the conducting system. And 40% of the people, if we talk about the venous drainage of the heart, we see that the heart is drained mostly into the coronary sinus, which is the main vein that drains the heart, and it drains into the right atrium. This coronary sinus is the main vein, and it is a wide venous channel that runs from left side to the right side on the posterior part of the coronary sinus, and it opens into the right atrium. The coronary sinus has its main branch, which is the great cardiac vein. This great cardiac vein starts in the anterior part of the interventricular septum as the anterior interventricular branch. This anterior interventricular vein moves along with the anterior interventricular branch of left coronary artery, and then it turns left into the coronary sulcus. It moves around the left portion of the heart and is continued into the coronary sinus. This also gets a tributary, which is called the left marginal vein on the left side. Another large venous network is the middle cardiac vein. This middle cardiac vein follows the posterior interventricular branch of the right coronary artery in the posterior interventricular sulcus. It opens into the right side of the coronary sinus. The right side of the coronary sinus also has the opening of the small cardiac vein, which accompanies the right marginal artery. This also follows the coronary sulcus and opens into the right side of the coronary sinus. There are some other veins which are also associated. These are the anterior cardiac veins. These anterior cardiac veins drain almost the right atrium, and they open directly into the right atrium.